Okay, so this is a general routine for working out, doing weights. This is part of my 5-element exercise plan for healthy, balanced working out. This is the best plan for long-term longevity, health. The first element in the 5-element plan is cardiovascular, and there's 2 ways of doing cardiovascular. And I'll have more information on that in the handout. But the first is doing high intensity interval training. You want to do HIIT training at least 2 to 3 times a week, and you can do it on the elliptical. You can do it on bike. You can do it running. If you run, you want to kind of do it on a slight uphill, or if you do a treadmill, do it on a slight uphill. And you always want to warm up for about 5 or 10 minutes before you do any high intensity interval training. And when you do that, you can do anything from 30 seconds to 3 to 4 minute intervals. Okay, obviously starting out, you want to do probably just 30-second intervals. And the key to an interval is to go as hard and as fast as you can go. So if you're on the elliptical, you can crank up the resistance, right? And then, or if you're running, you can find a hill. If you're on the bike, you can find a hill or crank down the resistance if you're on an exercise bike. And you just go as hard as you possibly can. You don't want to use heart rate as a measurement for this if you're using heart rate, because there's a lag in heart rate time. There's a lag that the heart rate doesn't increase for 30 seconds to a minute. So you just want to go as hard as you can. And then typically when you're starting out, you want to do double the time of the interval for recovery. So if you do a 30-second interval, you'll do a 1-minute recovery. You don't want to stop working out. You just want to slow it down. You want to keep moving during recovery. So if you stop, that's a lot of times when it's really hard on the heart and lungs to just stop. So, and then the second way of doing cardiovascular is doing more steady state, right? Where you just go and you do about 65 to 75% of your heart rate max. To find your heart rate max, you don't want to do 220 minus your age. That's an old program. You actually have to do a heart rate max test, and you can find someone to do it for you or with you, and there's some information on the handout too on how to do that. But 220 minus your age is a general one. If you don't have any way of testing your own heart rate, then you can start with that. But you want to, steady state is where you do 30 minutes, 45 minutes, an hour at just kind of anywhere between that 60 and 80%, 65 to 75%, 60 to 80% heart rate, and just kind of be at a steady pace. Then the second one is doing stretching. You always do stretching after cardio. You don't want to stretch without doing some cardio. Okay, that way the muscles are warmed up, and that's another video. The stretching is another video that we go through, and do a whole stretching program. Usually takes about 20-25 minutes. Then the third thing is to do weights. So you always do weights after you do cardio. You want to do some cardio and stretching before you do weights, and then we'll go through the weights on this video. You also want to do core, okay? And I usually do core after I do stretching. So that's the fourth element of the 5-element exercise plan, is doing core. And then the fifth one is balance and proprioception, which we'll go through some of that in this video as well. So, so we'll get started. So remember that when you're doing weights, you do cardio first, you do some stretching first, and then you do the weights. And there's 2 kind of different ways of doing weights. You can do high weights and low reps, and you can do lower weight and then higher reps. And you just want to mix it up. You don't want to do the same thing every time. You also, when you're doing weights, what I like to do is do a circuit. The old way of doing it is to do kind of chest and arms one day, and back and biceps the other day. You want to do kind of a whole body workout typically. And the reason why is when you do just one or two body parts really heavily, then you create an imbalance in your muscles, and then you're kind of stuck in that imbalance until you work out again. So we use what is known as reciprocal inhibition. So when you work out one body part, like the biceps, the body will automatically de-innervate the reciprocal muscle, okay, and it will inhibit the reciprocal muscle. So if you're working out one muscle group really heavy one day, you're going to be inhibited in the opposite synergistic muscle, okay. So you want to do both muscle groups in the same day. So I like to start off with either a lat pull-down machine, or if you're good enough to do actually lat pull-downs, you can do it on a lat pull-down here. So we're going to start with a lat pull-down machine. You always want to pick a weight that, whether you're doing high weight and low reps or low weight and higher reps, you want to pick a weight that by the time you get to the last few reps, you should be at your limit. You should be at your max. Meaning it's going to feel pretty hard. If you do lower weight and higher reps, that's more like 20 reps, 20 to 25 reps. The first 10 or 15 are probably going to feel pretty easy, and then the last 5 or 10 are going to feel a little burn. And then if you're going to do low reps, like 5 to 6 reps and a high weight, then it's going to feel hard even that first one. Okay? But they do two different things physiologically. One strengthens more ligaments and tendons. The high rep one will do more toning of the muscle, more synovial fluid. But the high rep, or the high weight, that tends to strengthen the ligaments and tendons a little bit more. It's healthier for the joints. So, so I'm just going to show you proper technique in this video and kind of how I do a circuit. Okay, how do I do a quick circuit? Circuits, you can do the circuit probably 2 or 3 times, okay? So I like to start off with, again, you're going to have already done some cardio and some stretching. So we're just going to jump into a lat pull down. Now there's different ways of doing this, but I like to go forward and back. So you want to get full range of motion, so when you're at the top, the elbow should be pretty straight, okay? Now, I'm gonna say this many times, called neutral spine. Whenever you work out, whenever you do a weight workout, if you're not in neutral spine, then you're anchoring in an abnormal posture. So we want to anchor in a normal, good, healthy posture, which is neutral spine. The first component of a neutral spine is a slight posterior pelvic tilt for most people. You can find your neutral spine by going all the way forward in an anterior pelvic tilt. So you really heighten this lumbar curve here, and then you go a posterior pelvic tilt, which flattens the curve. The axis of rotation is around your hips here, okay? So you go forward, pouring water out the front, and then you go back, pouring water out the back. That's a posterior pelvic tilt. If you look at like my belt as the rim of a bowl, and your pelvis is the bowl, I'm pouring water out the back. That's a posterior pelvic tilt, or the opposite, anterior pelvic tilt. So you want to go full posterior, full anterior, then right in the middle. Like I said, for most people, you want to err on the side of posterior pelvic tilt. Okay, so flatten this part of your back, and then your shoulders should be over your hips, and then your ears over your shoulder, and then your chin tucked in. So if I were to drop a plumb line from the middle of my head down, it'll go through my ears, through the middle of my shoulders, down my back, through my hip bone, and then through the just anterior to the ankle bone. Okay. So that's where you always want to remember and remind yourself, neutral spine, neutral spine. So before and during every exercise, just say neutral spine, okay? So I'm in neutral spine. Now from here, if I'm going to go to the front, okay, all the way down, And then this is about the pace you want to go. Okay, you don't want to do fast, and you don't want to go too slow, although that's another type of rep. So we go back, okay, and then we go forward. Now, I am going forward and back, but the axis is here, so I'm still in neutral spine from my hip to my head. Okay, so you just do the lat pull down. Okay, again, if you're going to do high weight and low reps, then you want to pick a weight that feels hard at the beginning. Higher reps, lower weight. Shoot for about 20 to 25 reps. Okay. Now, think of this as push-pull. So I just did a pull move. So what's the opposite of a pull move, right? So I just pulled weight towards my body. Now I'm going to do the exact opposite, okay, for reciprocal inhibition, balancing, and that's a push move. So I'm going to push weights against my body. So that's going to be kind of a shoulder exercise.
Mm-hmm.
So for balance and proprioceptive purposes, okay, I like to use free weights. Whenever you use free weights, you activate your balance and proprioception. What I mean by balance and proprioception is you're challenging your body's awareness in space. So when I do this and I step, my body has to balance. My body has to be very aware of where I am in space. And that's different than just doing machine weights, right? If you're just stuck in a machine, then there's really not a lot of balance and proprioception. So we're going to do a little bit of both. Also, doing some work on the ball is good, like an exercise ball. So I like to combine exercises. So this is going to combine a lunge with a shoulder exercise. So I'm going to start shoulder width apart, neutral spine. I'm going to step forward. A proper lunge, the knee never goes past the toe. So I'm going to step forward and then drop straight down. Okay? So that's a proper lunge. Now, as I step back up, I'm going to do a curl. Okay? And then as I come back to shoulder width apart, I'll do a shoulder press. The proper way to do a shoulder press is the palms are facing in towards you as you're in the starting position, and then as you push up, they turn, okay, and they face out as you get to the top position. You never lock out a joint. You never want to lock out a joint. You never want to completely lock a joint. Okay? You want to go just before the joint is locked. Okay. So then I do the opposite. I take a step. I come down as I step down, okay? Step up, do a curl, step back, do a press, okay? So then it's step, down, back, up, nice and smooth. Step, down, back, up. And then you can kind of change it up and do a little more balance and proprioception, okay? By stepping out to the side, doing like a 45-degree angle, okay? And then you step to the side, good, and then come back to the front. So this is a very good whole body exercise. So that is, so now I've just done this sort of vertical chain. Now I want to do a more horizontal chain, okay? So we'll start with chest. So we did lats, the lats. We did shoulders with a lunge. Now we're going to do chest. Now there's two ways of doing chest. There's many different ways of doing chest, and in the handout I've got all that information. But I want to show you correct form. So I'm going to do two chest exercises, okay? And then we're going to do another round of everything. I'm going to show you variations on that. So we can start with just a basic bench press, okay? Not a lot you have to do with balance and proprioception on this one, but so we come down and you want your wrists in a good lock position. You don't want to do this, you don't want to do this. You want it in a good closed packed position. Okay, you want your wrists under your elbows pretty much. Okay, you don't want it too far out, you don't want it too far in. Just straight under the elbows. Okay, and it's just a very nice, slow, controlled movement. Okay, down. You never want to slam it. Okay, you don't ever want to kind of come down and like push it off. Okay, you want to just nice and controlled through the whole thing. Okay, and if you're going to do weights like this, always good to have a spotter. Okay, make sure you have a spotter. The other, so that's going to be more high weight, lower reps. You can do high reps and low weight in this too, but if you're going to do a lower weight and higher reps, this is one that I like to do. This really adds a lot of balance and proprioception. So we're going to come in here and so you get a fit ball. And again, fit balls are great for balance and proprioception because it forces your brain, okay, your dorsal columns in your brain and the vestibular system to have to work harder to know where you are in space. Okay, so pick a ball. These are all a little flat. Pick a ball that's when you sit on it, okay, you're at about 90 degrees. Okay. Shoulders at 90 degrees. Now, again, this is a little bit flat. You don't want quite this much give, but this will work for our purposes. So, a 6-foot person is probably going to do a 65 centimeter ball. Anywhere from 5'8" to 6 foot, you have a 55 centimeter ball. So, so this exercise, there's a couple different variations that I'm going to show you. This is for chest. This is a push-up. So you can do a push-up with your hands on the ball. Okay, so you start with neutral spine, put your hands on the ball, and you roll forward from the knee. Okay, everything from the knee up stays in a straight line. And you roll the ball forward, okay, till you come down, and then you push up. Okay, come back, you push up. Okay, this is what a lot of people will start with, okay, especially women or men who haven't been working out for a while. This is a great rehab, when you're just starting to get your strength back. The next progression on this is to put your feet on the ball, okay? This is where you really get core, proprioception, balance, and strengthening in this. So you put your feet on the ball, okay? And you want the ball back by the foot. If you roll it forward, it'll help stabilize a little more. But if you want the full balance and proprioceptive effect, go ahead and push it back towards the feet, okay? And then you can put your feet together. That adds even more. Or you can put it apart, and that stabilizes it, okay? So then here, neutral spine, go all the way down, back up. Neutral spine, head back, chin in, push to your pelvic zone, all the way down and back up. So that you can also use a spotter to just help you. So when you're just starting out, but if you haven't done that before, it'll seem hard at first. But after the first few times, you'll really get you'll get your balance, get your strength. Now, the next progression on this is if you have a Bosu ball, okay? So you can actually turn this over and then put your feet on the ball. Okay? Put your hands on the Bosu ball. Okay, I'm going to walk this out a little bit and do it from here. This gives you multiple planes of balance and proprioception. So from here, just come here. Now this one's nice because you can grip it on the edge versus here, which will be harder on the wrist. So you can grip it on the edge, and that's a 0 wrist. Okay. So we just did some chest exercises, right? That can be considered a push move. So then what do we want to do? We just did a push, so then we want to do a pull. Okay. So I'm going to show you a couple variations on a pull move. I'll keep these here because we'll come back to this. So I like to do, whenever you can, you want to do one-handed. Okay, you want to do a one-handed workout. That again activates core and balance and proprioception. So if we just did a push, right, and we want to do a pull, this is called a seated mid-row. Okay, it's like we're rowing. But again, you want to do this with one hand if you can. So you get in a position where you can be in a neutral spine. You can grab the weight. You do one hand, and you want to keep your shoulder down. Okay, this is the action that we're doing. Okay? It's like we're rowing, right? So we're gonna keep our shoulder down. We never want to kind of come up like this. We want to keep our shoulder down, and when we get to here, we want to bring our shoulder blades together. Okay, let it go forward all the way and back. So it's here, forward, back, squeeze, forward, back, squeeze, forward, back, squeeze, forward. Again, do the number of reps equal on both sides. Okay, neutral spine, forward, all the way, let it come forward all the way back. And you don't want to lean against something on this exercise, because then you miss the transverse abdominis, you miss the erector spinae, the QL strengthening. Take advantage of everything you can in a workout by removing the stabilization. So it's a lot different workout if you're doing this, right? Because then this is doing a lot of the work for you. So you can also do a mid-row with a bench. Okay, same thing. You're going to be neutral spine. Let it come down as far as you can, and then come up. Okay, it's just same thing. Let it come down, up. Keep your shoulder down, and then squeeze at the end. Okay, squeeze at the end. Now, if you want to do this on the ball, so stay there. You can also do this on the ball. So for a little bit more balance and proprioceptive effect, you can put your hand and your knee on the ball, okay? Stabilize with your other foot and come up and do this, okay? So that's another way to add balance and proprioception. You can also do bench on this. So back to another variation on the chest. Just do, if I'm going to do this, I like to do flies. Okay, so you come here and you leave a little bit of bend in your elbow, and you just open wide all the way down and back up. And keep your muscles activated, keep your transverse abdominis activated, okay? So I'm here, wide, back up. So that's another variation on the chest muscle as well. There's another variation too on the back muscle, where you can get some light weights. So this is a variation on the mid-row. Okay, so neutral spine. Okay, so you do kind of a posterior version of this. You just do the exact opposite. Okay, come back, and you just go back all the way as far as you can. Okay, can also go forward. That gets your posterior delts, okay, and just as far as you can, go back. Okay. So that gets the back side of the muscle as well. So what I typically like to do is go through one exercise per body part, all the way around, do the circuit, and then do another with slightly different exercises, and then you can do a third one. So we just did one round. We did the lats, okay, we did the bench, and then when we did the lats, then we did the shoulder with the lunge, then we did the bench, then we did the mid row. So the next time around, you can do the lat pull downs again. There's not too many variations of that. However, if you can do a regular lat pull down, okay, or chin up, you know, then work up to that. And what you can do, if you can't do a full, well, let me show you the correct way to do a full one, because there's different ways of doing it. Try not to bring your head too far back when you're doing this, and try to keep it slow and controlled. So when you're doing this, you don't want to kind of go fast. You want to go nice and slow. Let it go. Let your elbows straighten out almost all the way, okay, and then back up. Come up above your chin, and then do nice and slow, okay, and then back up. And when you get to the edge at the top, you want to kind of squeeze your stomach muscles. So here, squeeze your stomach muscles, and then back down, okay? Now let's say you can't get a full one, so you can assist yourself using a Bosu ball, okay? So you can get on here, okay, with your knees, and then just push up and kind of, and use your feet to push you up and give you a little bit of help. Or you can keep your feet on the ball, okay, and then you can kind of just stand up, okay. But this gives you, even if you can only do a couple of them, doing it with one of these is really helpful. Okay, it'll strengthen your lats a lot quicker. Now let me show you a variation of a shoulder exercise. So so we did the shoulder exercise with the lunge. A variation of that are flies. Okay, so you stand shoulder width apart, and here you want to keep a slight bend in your elbow, and again, neutral spine, and you're just going straight out, and you try to picture your pinky going up to the ceiling first. So you kind of do this, and keep your pinky, your palms facing down. You don't want to do this, right? You want to do this. See how my pinkies are kind of going up first? Okay, so you come up, and then back down. And you don't have to go much above eye level, because then you're not really getting much of a workout and benefit at that point. So you don't have to come all the way up like that. Okay, you just want to come up to about eye level, and then back down. Okay, up, nice and slow and controlled, back down. And then if you do this one, then you can do the forward as well. Okay, again, just to eye level, slight bend in the elbow, and then back down. Okay? All right, let's see. That pretty much gets you started with everything. If you want to add the legs to it as well, we already did the lunge, okay? But that takes care of the upper body. Let me show you just a few lower body ones, okay, that you can use with the ball. So let me grab a fit ball again. So let's go over here. So this one's actually more powerful than you think, right? You probably want to come around here to the side. So put your heel on the ball, okay? Just your heel, not your legs, just your heel. And you do what we call a supine bridge, and nice and straight. And then from here, you bring your heel into your buttocks, keeping your butt up, okay? Bring your butt up as don't let it sag down. Bring it up, okay? And you can stabilize yourself more if you need it by your arms out, or you can bring it in for more destabilizing, for more activation of your core, okay? So you can kind of, I just use my elbows a little bit, okay? Or like I said, out further if you need more stabilization. Okay, so that gets your glutes, gets your hamstrings, even gets a little bit of your calves. This will get your quads. So you do the opposite, right? We always do the opposite muscle group. So this one will, again, neutral spine. Bring this ball to your toes, and then you bring your knees up. Okay, nice and slow and controlled. This gets your quads and your anterior tibialis muscles, and just that's a full body workout. You can also do wall sits. You can just sit. Let's go in here and do that. So you can do a wall sit, and when you do a wall sit, you can do, just make sure you're at 90 degrees and neutral spine. Activate your core always, and just sit, in this position for, anywhere from 1 to 3 minutes, depending on, how much you want to do and how much you can tolerate. So, so that gets a lot of different muscle groups too. You can also do a wall squat. And here, you want to do that with a fit ball. Okay, let's see, we'll do this, I guess we can do this here too. So for this, you want the ball resting just above, on your glutes pretty much, just above your glutes. You want to walk out a little bit so that when you come down all the way, your knees don't go past the toes. So you're in neutral spine, okay? Cross your arms and you bend down all the way. Okay, as far as you can go down, and then back up. And then as you get good with this, you can do 20, 30, 40 of them. You can add weights. You can just get some hand weights and come down. And I like this a lot better than Smith machines and weights on your back. A lot of people, right, you've seen the squat racks where they have weight on their back and they'll do it. First of all, it puts your back, you have to lean forward, and it puts your back at a disadvantage, so it will create a lot of back problems doing it that way. It's also impossible, even with a Smith rack, which is in rails, to keep your knees from going past your toes. Okay, so that puts your knees at a disadvantage, and it's putting a lot of compression on the thoracic spine, just holding that weight. So I'm not a big fan of, I've treated a lot of weight lifters over the years, and while squats feel good, they're pretty hard on the body. So I'm not a big fan of that. So again, you can do quite a bit with carrying, having heavy weights here and bringing your shoulders back, so you get some shoulder and neck strengthening that way, and walk your feet out and just coming down and coming back up. And if you get stuck down here, just push against the ball more, and that will give you an assistance. If you want a better workout as you're coming down, try not to push against the ball at all. Just come straight up. Okay? So that's pretty much a good way to do it. In future videos, I'll go through more advanced exercises, more variations and techniques, but this is the basic weight training, resistance training. The other thing I want to finish with is just saying that research shows you do not really need to, nor would you want to, do weights more than once or twice a week. Okay, doing a circuit of these 3 times once a week has been shown to give you just as much joint benefit, physical benefit, health benefit as doing it 3 times a week. So you really don't get more benefit doing it 3 times a week. Now, obviously, if you're trying to bulk up for some reason, or you have different reasons for doing it, then that's another thing. But for health, longevity, really doing an hour a week of weight training is all you need. So that's lowers your risk for cardiovascular disease, lowers your risk for Alzheimer's and Parkinson's, lowers your risk for arthritis and degenerative joint disease, many different ailments. So that's your basic program. So be sure to you can download or email my office for the full 5-element exercise plan. So thank you.